Layout of Kigali Health City, a medical facility located in Masaka, Israel. Praise. On the 7th of October 2023, Masaka in Kivu-Up district gave birth to the firstborn in a large-scale modern medical project that has attracted the attention of the country and Africa as a whole. The project that preceded another one of the planned medical facilities in the city of Kigali, Kigali Health City, belongs to IRCAD Africa. This institute is affiliated with the French Institute for Research and Training in Human Surgical Technology, IRCAD France. IRCAD specializes in minimally invasive surgery for gastric cancer. It uses the technology of robot and camera in human surgery so that it has less pain and faster recovery. IRCAD Africa is headquartered in Masaka, an area specially designated for the installation of high-quality medical infrastructure. This is part of Rwanda vision to be a host of different services and different projects from sports, technology, economy to health and to build tourism based on it. The Center for Research and Training in Colon Cancer, IRCAD Africa, has started its operations in Rwanda. The Minister of Health, Dr. Nsanzimana Sabin, recently told the media that the joint project for the provision of health services will help speed up and provide them at a higher level. He said that the completion of IRCAD Africa is an important step in the implementation of other projects. He said, "We are happy to see the first project implemented and we hope that it will continue to go well. This center is one of the many health projects we have in Masaka." Hospitals, pharmaceutical infrastructure, laboratories, hotels, schools, etc. are planned in this area of Masaka. Minister Dr. Nsanzimana said that, "There are other buildings under construction here and there. There is the Kigali General Hospital (CHUK) that needs to be relocated, buildings that are far away, there is a center that will be doing research, and it will be for people with heart problems, Heart Center, which is scheduled to be completed in a year. Next door there are other large-scale projects that include the construction of major pharmaceutical or diagnostic laboratories." What CHUK Hospital will look like when it is completed in 2025. In Masaka, it is planned to build an international-level university so that the knowledge of the patients will be introduced and the doctors of the future will be born. Initially, the University of Global Health Equity (UGHE), which currently operates in Butaro in Barera district, will be the seat of the university that offers courses related to medicine and health for all. He continued, "We found it good that this area becomes a health center where all the health projects would be researching, teaching and treating, looking at medicine and testing in one place. Due to the fact that those in the medical field will be living in this area and the patients will be received by their caregivers, it is planned that hotels and houses will be built where they will stay, shopping malls and other places where they can get basic health services." Dr. Nsanzimana said, "We will also build houses for those who work for them, doctors or patients, where they can buy what they need, food, children's education, etc., so that a person who works or lives there does not have to move to find other services, even if they are here." The Minister of Health, Dr. Nsanzimana Sabin, expressed that Rwanda is looking forward to the construction of infrastructure that will allow it to build medical tourism. There are currently no plans being developed for what the current medical system will look like. It is a project that will be placed on an area of 100 hectares. It is being handled by various institutions, including the City of Kigali, the Ministry of Infrastructure, the Ministry of Health, the Ministry of National Development and others who meet in a committee that monitors the day-to-day. Dr. Nsanzimana says the plan will provide freedom to those who need medical services and be transparent. He said, "You wouldn't have a mosque or a temple in the middle of a hospital when you could have a laboratory. We need freeways because people need places to go." It is a study that has been done and reached an interesting level. The infrastructure that will go to this city will be in that line. The first projects have already been delivered in Masaka and others are coming up in the near future. IRCAD Africa has already been completed and knowledge has been introduced. 60 medical specialists from 21 countries, including Rwanda, initially started studying at IRCAD from October 2, 2023. It aims to train at least 300 medical specialists per year. This center is in close collaboration with My Heart Center, which will be conducting research, also for people with heart problems. This facility, located on an area of 4.4 hectares, began construction on December 29, 2021. It is expected to be completed in 2024, costing $20 million. It will have the capacity to accommodate 1,000 people in the hospital. My Heart Center is a center that will treat heart diseases located in Masaka in Kivu-Up district. From where these two institutions are located, cross the road, and there is the construction of a hospital that will be transferred to the University of Kigali, Chuck. Construction work began on March 30, 2023. It will be completed in 2025, costing 85 billion FRW. The plan shows that it will have a 3-story patient building including a 5-story annex. It will also have research, teaching and other buildings. It has 837 beds and the capacity to receive 2,000 patients a day. In Masaka, there are also plans to build a sampling center for non-communicable diseases and laboratories, including the Rwanda FDA and the National Institute of Medicine, RBC. This will help the country in the process of making medicines in Rwanda instead of continuing to import them. My Heart Center is expected to be abandoned next year. The buildings of Kigali Health City have started to be upgraded and My Heart Center is scheduled to be completed in 2024. This center is located in Masaka in Kivu-Up district. It is expected to help those traveling abroad for treatment of various heart diseases in a cost-effective manner. It is being built with the cooperation of the government of Rwanda and the Heart Care and Research Foundation Rwanda. This center is expected to treat, train doctors and conduct research. In addition to cardiology services, the center will also provide training and research for doctors, nurses and others. This facility is located on a 4.4-hectare plot of land. The reconstruction works cost $20 million. In the next year it is planned that these buildings will be complete. This center will be a research center, also known as the Heart Center. It will benefit Rwandans and Africans in general. Construction of the facility began on December 29, 2021. It will have the capacity to accommodate 1,000 people in the hospital. This facility is built according to modern architecture. Buildings are built in different areas depending on what is planned to be done there. The construction work of Chuck Hospital in Masaka is at a standstill. Over 85 billion FRW was invested in the construction of the expansion of the Chuck Hospital that will be moved to Masaka. The University Hospital of Kigali, Chuck, will move to the former Masaka Hospital which is currently in Kivu-Up district. It was originally built in 2013 with the support of the Chinese government. The groundbreaking ceremony for the new hospital was held on March 30, 2023. It will be built by the Chinese firm Shanghai Construction Group Company Limited. This hospital will have the capacity to receive 827 patients while Chuck will receive 400 patients. The new Chuck will have 3 multi-story patient buildings including a 5-story annex. Chuck Hospital is expected to be completed by 2025. The hospital has research, teaching and other facilities. The construction work is being accelerated so that the appointed time will be fulfilled. These hospitals are expected to provide high-quality medical services. Chuck is one of the projects that will be located in Masaka, a place dedicated to healthcare. Infrastructure like this shows Rwanda's commitment to building medical tourism. Other large-scale medical projects are planned near Chuck Hospital. Different communities are benefiting from the work of building this hospital because many of them get jobs to support themselves and their families. Masaka, an area designated for medical infrastructure in Kigali. Masaka is a highly populated area in the city of Kigali. In the coming days, the residents of this area will have access to high-quality medical services. The Kigali Medical Center planned to be built in Masaka will be on an area of 100 hectares. The design of the infrastructure is being developed before it is released.